Alright, hey guys, and welcome back to the Bolder Side of Wellness. I am Lisa Barrows.
And I'm Ashley Palmer.
Make sure you're following us on Instagram at the Bolder Side of Wellness. You can follow me at Honestly Lisa B.
Or me at Ashley Palmer Fit. I always butcher that.
It's okay. We also have a website now, bouldersideofwellness.com, where you can find our episodes. We're going to have blog posts, videos. Still learning to build it, but it's happening, so it's fine. So welcome back. And YouTube now.
I know. You get to see our faces now.
Yeah. We were lucky enough to recently collaborate with an awesome podcast, the KG podcast, and had a blast. They go on YouTube and had a good chat with them. And now we're going to be doing videos as well. So if you want to watch us, see these pretty faces, you can do that.
Yeah, you can put us on your big screen. Like, we won't take offense.
Yeah, and they can see how much we talk with our hands
now.
But that collab was awesome.
Yeah.
That
was fun.
So much fun. If you don't follow it already, go follow them. Good people talking about mental health. It's just great vibe. Yeah. Great. Yeah. Awesome. But we are now, talking to some local businesses in the health field. And so today we are going to talk about acupuncture, which is fascinating, kind of outside of Western medication. I know pretty much nothing about it.
Yeah, me either. Other than needles and dark rooms.
Yep, needles. I know this particular practice does some cupping, which I've minimal information about, but we're going to talk to Danielle Sousa. Her practice is in Middleborough, and she and one acupuncturist and an assistant kind of run their business, and she's been doing it for now 7 years, but she is awesome, so looking forward to that.
Yeah.
All right, guys, I want to introduce our guest. This is Danielle Sousa. She is the owner of, I'm going to have you say it again.
Essence Community Acupuncture.
Essence Community Acupuncture. Yep. Having trouble with words today. But born and raised in Middleborough, it is located in Middleborough, and they do acupuncture, herb work, cupping, plus there's a whole wellness center. So I'm going to let her kind of introduce herself a little more and talk about what you guys do.
Yeah, well, thank you guys for having me. So I own Essence Community Acupuncture in Middleborough. We focus on acupuncture and Chinese herbal medicine. There are some different styles of acupuncture. Basically, there's Chinese, Japanese, and then more an orthopedic style of acupuncture. I do more of a mix of, kind of all three. I tend more towards Chinese acupuncture and then an orthopedic kind of trigger point style of acupuncture too.
So how does one get into acupuncture?
So it's kind of a funny story. I started undergrad pre-med. I wanted to be an oral surgeon for my entire childhood. I don't know why I fixated on that, but I did. So I went, pre-med, pre-dental in school, and then I did an internship with an oral surgeon, and I just hated it. It was so boring.
That's
and
I
was like, well, what am I going to do now? So I had acupuncture done in high school and early college, and it was really fascinating. It worked great for me, and I was like, I wonder how I do that, secretly hoping it would just be a few months certification or something like that, and I wouldn't have to go to school for too long. So I looked into it. It's a 4-year master's degree, so I finished my pre-med undergrad, and then I went right into grad school and got my master's in acupuncture and Chinese medicine. So, so that's pretty much it.
Where'd you do that?
So that's at the New England School of Acupuncture. They are part of Mass College of Pharmacy and Health Sciences. Gotcha. So they're in Worcester right now. They have a whole new center and student treatment clinic and everything like that at the Worcester campus. Which is really great.
Right.
So they merged with Mass College of Pharmacy when I was a student there, and I think it's done a lot for the profession because now, the acupuncture students are working with the nursing students and optometry students and the PT students and all of that. So it's really integrating it into other professions, which is awesome.
Is it required to be pre-med to go into it? Or?
You don't have to. There are certain prerequisites that you have to meet, which are most of are all of the pre-med classes, the anatomy, the organic chemistry, all that kind of stuff. For some reason, they want you to know all that before you go to acupuncture school, which is wild because the anatomy makes sense, but some of the other stuff is a lot. But it's a complete mind shift going, your mindset is Western medicine, all this stuff. And then you go into acupuncture school where you're learning like traditional Chinese medicine theory, which is, channels and meridians and qi and energy, which is just totally different than what you learn pre-med. But it's good to kind of know. I like knowing both sides of it. So it's helpful.
And it must be interesting, too, because, like, obviously we're Western medicine, which, like, not the biggest fan of personally, but I like the holistic approach to things, and I'm sure all your clients do, too.
Yeah, yes.
All right. So tell us a little bit about, like, the theories of, like, Chinese acupuncture.
Yeah. So...
yeah, why that one out of the other ones?
Yeah. So, the differences are subtle. The points are generally the same in all different styles of acupuncture. So there's over 400 to 500 different points, just base points. So basically the theory is that in your body you have meridians, which are all named after organs. So there's, heart, kidney, lungs, spleen. There's also pericardium, which is the lining of the heart. And then there's a different kind of meridian called the triple warmer, which is essentially like your torso. So you have an upper, middle, and lower warmer or jiao in Chinese. And it just like is pretty much kind of how all your organs function, the endocrine system, stuff like that. So all of those meridians run from head to toe on the body. Most of them start either at the head or the feet, and then they go the opposite way. So how that works in Chinese medicine, and what's really cool about it, is you don't have to needle where someone's having an issue or having pain for it to have an impact. So a lot of times I will get patients with back pain, but they can't lay on their stomach on the treatment table for me to be able to, put needles in. So in that case, we have recliner chairs. We have the patients sit, comfortably in a recliner, however they can get comfortable. And we have points on hands, feet, head, legs, stuff like that we can do that will help open up the channels in the back. And really, what's so fascinating about it is they came up with these meridians and channels and mapped all these out thousands and thousands of years ago before we had MRIs and nerve testing and stuff like that. They're finding out now that these meridians are following nerve pathways, fascial lines, all of that stuff in the body. And it's like, how did they figure out this stuff?
Before,
just like by trial and error. And same thing with the herbs. Some of the herbs are just like wild stuff, like the special seed or the special root from this plant, or, like there's some animal products and it's like a bone of the, and I'm like, how did they figure out that these herbs do these things? I guess there's a lot of trial and error, though.
Right. I'm curious, like, how do you decide, like, this needle will help? Like,
yeah,
and
I'm
went
like,
with it.
There are over 400 just standard meridian points. Never mind, like, extra points that, like, more modern, theory and stuff has found out.
Right.
But I'm like, how did they map out all these points? And some of the points are so subtle, they're less than half an inch away from each other and stuff, but they do different things, and it's like, wow, that's really cool. Crazy that apparently they did some sort of research studies thousands of years ago to see, oh, this point works better for this than that one does. So it's pretty cool.
That is fascinating that their brain would work like that.
And
it's good for, like, when you have pain too. Like, if my knee hurts, like, the idea of a needle going into that doesn't feel good. So it's easier to be like, okay, you're gonna deal with my wrist. I can deal with this.
And, sometimes people do come in, particularly with joint issues, and they are really upset and, like, really angry, red, swollen, stuff like that, and you don't really want to put a needle in it at that point. So there's different techniques you can do. You can do mirroring. So if one knee is injured, you can treat the opposite knee, and the theory is that the channels of those knees and those nerves coordinate with the other side, so you can treat it that way. There's also, you can do more distal points on those channels to help clear them. You can also treat, there's another theory of thought that you can treat opposite, like, mirrored this way, so you could treat opposite elbow to treat the opposite knee, so there's points on that, so it's pretty crazy. And there are some techniques that are immediate, you know, that I put in a needle and I will have someone like move, you know, their arm or their knee or whatever and say like, okay, let me know when it feels better, and like you'll push on different points and see when they're gonna feel a change, and that's when you know that's the right point. So it's pretty fascinating, and it's honestly mind-blowing to me too. I've been doing this for 7 years, and I just like when someone comes in and they're like, I had no pain after my last treatment, I'm always like, wow, that's just crazy. You know, it's crazy because I do it every day, so it seems like so simple to me, but then I just do my usual treatment, and I'm like, all right, we'll see how it works. And then they come in, and they're like, I had no pain. And I'm like,
well, there's your why.
Wow.
Yeah, that's why you keep going.
Mind blown. So it's great.
That's so cool. Well, it sounds like you continue to learn every time, too, so it, like, doesn't seem stale.
No.
Yeah, I'm sure you have different people coming in for different reasons. I mean, the good majority of people have back pain, but, like, everyone has, like, is that what you see a lot of?
We do. So, yeah, we see a lot of back pain. The other acupuncturists and myself both specialize in women's health and fertility, too. So we see a lot of, you know, patients going through IVF, pregnant patients, postpartum, women going through menopause, and stuff like that as well. But, you know, majority of it is pain, all different pain, though. But that's what I didn't like about my internship with the oral surgeon. Every time I went there, we were just removing wisdom teeth. Every time. And I was like, you know, occasionally you get something different, but for the most part it was wisdom teeth. And I was like, I'm not even doing the surgery. I'm sure it's more interesting if you're the one doing it, but I was like, oh, another wisdom tooth. Right. But now, you know,
spicing things up.
Yeah. I have, you know, a few treatment rooms going at the same time, and I have one person with back pain, I have one person going through IVF, I have another one with digestive issues, I have, you know, someone else with arthritis, and I'm just like, I just bounce back and forth between the rooms, and then another person comes in, and I'm like, all right, now I gotta, you know, think on my toes and think of something else, so it totally gets, it never gets boring, which is awesome.
Is there anything you treat that people probably don't know that acupuncture could be good for, like emotionally or anything like that?
Yeah, we treat, you know, it's very rare that there's something that acupuncture can't treat, you know, so a lot of people will come in with their main complaint of back pain or something like that. We have them do an extensive health history, and a lot of people are like, oh my gosh, my doctor doesn't even make me do this much, you know, information. Like, why do you want to know everything about my digestion and like
everything's connected?
And I'm like, well, actually, because people don't realize what is not normal. When you've had something going on for so long, they don't understand. You know, I get so many people that come in, and I'm like, digestion's good. You didn't, you know, put anything, and they're like, oh, you know, just like the usual bloating and acid reflux, but yeah, just fine. And I'm like, okay, well, like those things are actually not normal. So let's try to get to the bottom of that. But a lot of times there are rare acute injuries that, yes, if I just put some trigger point needles in, you're going to feel better. You're on your way. The majority of chronic issues are a whole body, you know, systemic situation that if I don't treat these other things going on as well, you're not gonna, you know, we're not gonna see any lasting relief in it. You know, back pain, as much as it's muscle and nerve and spine related, all those nerves in the spine also innervate your organs and digestive system and, you know, respiratory system and stuff like that. So, of course, if you have back pain, you're probably going to have other issues going on. Because those nerves and muscles are affected. So, you know, chances are, even if people keep those things a secret and just say, yes, everything is fine, within a few visits, they're like, you know what? I actually used to have, you know, terrible digestion, but suddenly it's just better. And I'm like, well, it's because we got everything else in line. And now your body's happy.
Right. Oh, that's so funny. We talk about this like with every practitioner and everybody. I feel like in here, like pain is not normal.
No.
Like people really, I feel like especially women, like normalize like discomfort.
Oh, for sure.
And yes. Like, oh yeah, everybody has this. Everybody's in pain. I remember being in the car with my dad and being like, "Do you always get sharp pains in the side of your body?" Like as a kid, and he was like, "No." I go, "Oh, me either."
Yeah,
like,
that's
like,
fine. Yeah, I don't have that.
Right, because my ovary, whatever. But like you don't know this stuff, so it is so funny. Yep. So you primarily get pain. So what does it look like? Like if I'm first-time patient walking in?
Yeah. So patients come in, they get all their health history, consent forms, everything like that through email. So before they come in. So they answer all that, so I'm able to kind of look at it before, know what's going on, but our health history is so extensive. It goes through, you put your main complaints, what you really want to work on, but then it goes through pretty much head to toe, like head issues, ears, eyes, nose, throat, digestive, bowel habits, eating habits, any allergies, any pain. Women, we go through your whole menstrual cycle and how that is and how that's regulated, your medications, surgery, all that.
Right.
So we go over that at your first visit, and some people are quick. Some people are literally just like, no, I just have this pain in my neck. Everything else, fine. And I'm like, okay, great, perfect. We will treat your neck. Other people are like, I didn't realize how much I had going on until I filled out this health history form. And I was like, yep, that's pretty normal. And people are like, I'm sorry, this is so much. And I'm like, no, this is why you're here. So we go through all of that. And then, so people will oftentimes come in with a diagnosis. So they'll say, oh, I have, bursitis of the knee. And I'm like, okay, that's wonderful. I'm glad that you have that diagnosis, but that doesn't necessarily mean anything to me, because everyone has different symptoms when you have a diagnosis, So I say, where are you feeling pain? When are you feeling pain? How is this manifesting for you? How is it impacting your daily life? What activities can you not do that you'd like to be able to do with this issue? And then we go over what makes it better, what makes it worse, and from that I'm making my own diagnosis in terms of Chinese medicine. So even more like systemic issues, like someone comes in with diabetes, like someone with diabetes has that diagnosis in Western medicine, but from my perspective there can be an array of different diagnostic markers that tell me what needles to do. So there's not like diabetes points that I put in, but I need to evaluate and figure out what else is out of balance with the body. So our diagnoses look a little bit more, they sound more like, spleen qi deficiency, with, blood deficiency or something like that. And sometimes people ask about their diagnosis, and I have to give them a little like warning and just say, when I tell you you have like liver qi stagnation or something like that, like there's nothing wrong with your liver. Like you do not need to go to the doctor. Like you're not gonna get cirrhosis or anything like that. Like it is just talking about the energetics of it. But it is funny because sometimes someone will ask me and I'll be like, oh, you have like a stagnation in like the gallbladder channel or something. And they're like, oh my gosh, I had my gallbladder removed last year. And I'm like, oh, well, cool. Well, now the energy's stagnated, so now we have to fix that. Gotcha. So it is funny sometimes when I tell people what their diagnosis is from Chinese medicine, they're like, oh, I actually, my doctor is watching my liver numbers, or, I had elevated enzymes or something last visit. And I'm like, well, that's fine. We're also just going to, treat it from our perspective. So we look at things like the organs. They all have different symptoms associated with them. We also feel the pulse, and we're not necessarily, we are feeling for speed, but not like rate and stuff like that like you normally would. We're feeling more for like quality of the pulse. So we have different descriptions of the pulse, and so it's like wiry, thready, slippery, weak, strong, full, stuff like that. Mm-hmm. And that is how we kind of confirm our diagnoses. And then we'll look at the tongue as well. We look at the color, shape, coating, all of that on the tongue. Okay. And I tell people the tongue is a really cool diagnostic, tool, because it's really, it's like an organ that you can see outside of your body. So we look at that, and it's amazing if you start looking at people's tongues. Like, you're just like, oh, it's just a tongue, but like everyone's tongue looks so different. Right. Like some people have a thick white coating, other people's will be bright red, other people's have this like geographic pattern on it. Right. So all of it tells us a different diagnosis in Chinese medicine. And then once we have our diagnosis for the patient, we can then choose our points that we want to do, because each point has a different action and effect on what we want to do. So if I diagnose, liver qi stagnation with blood deficiency, I know I need to do points that are going to move the liver qi, points that will strengthen the liver, points that will, strengthen the blood, points that will regulate hormones, all that kind of stuff. And I just basically need to pick 10 to 20 points that have all those actions. And then if they have local point issues too, like neck pain, I'll put local points and some trigger points at the neck and stuff too. Okay.
So with the needles,
we have some.
Yeah, oh, perfect. Are you putting something in the needle or no?
It's nope. Just where so they are filiform needles. So that means there's no hole in them. They are solid, stainless steel needles for the most. We do have some gold needles, titanium and stuff like that. But for the most part, they're just very thin, needles. So it's
they are so thin.
And is it just like you put it in and like leave it for a while? Or
so what it is, they usually come with guide tubes. I will usually use a guide tube to put it in. You can freehand it too, but we just will normally clean the point. But and they just go in. You can adjust it to the depth, the angle, everything like that you want. And then I tell people when they go in, there might be a slight little pinch once it goes through the skin, but once it's in, it should be pretty comfortable.
Right.
Some people feel like a warmth, tingling, achy sensation at the needles. Those are all normal. It's just the body's response to having a needle there. And otherwise, they just kind of rest for like 30 to 45 minutes. And then sometimes I'll come in and do adjunctive stuff, and that's where the cupping, gua sha, moxibustion, which this is moxa here, which is mugwort herb that we can, I don't do it on these needles because these have plastic tips, but I have other ones that have metal tips, and you can put a ball of this on the top and burn it while it's still in the skin, and then it warms the needle so that it gets more circulation and everything like that move into it. Yeah. So it's just dried mugwort herb that I don't know how they process it to make it make it be fluffy like that. But there are all different forms of moxa and ways we can warm the needle and stuff like that. So
I'm sure the question you get all the time is like, does it hurt? So I'm glad you brought that up.
Yeah.
Because it's flexible, it's so thin.
Yeah, it's very, very thin. And we have thicker gauges, I have different needles for different things. So these are our standard about 1-inch needles. I will use shorter ones for like points on like the hands, wrists, face, stuff like that. And then we have longer ones up to 3-5 inches that we will use in like the glutes and quads and stuff big like muscles. That. Especially, if we get like people that have really developed like glutes or, something like that, you need to use, unless you just want to get in the superficial muscles. But if you want to get to like the piriformis and stuff like that, you need to use a 3-inch needle because it needs to get through, the glute max and med and everything else first before it will reach the trigger points in some of the deeper muscles. Okay. So.
And with the cupping, you guys do with the fire?
We do fire cupping and we do suction cupping. On a day-to-day basis, we usually just do the suction cups just because it's faster and if we're just doing it quick. But if we do offer, my assistant offers full cupping sessions, and she does like the full shebang with the fire cups and everything like that. I'll do them sometimes. But yeah, so basically you take fire and swirl it around in there, and it creates a vacuum in the cup, and you just really quickly put it on the skin, and then it pulls it up.
That was the.
Are you doing that for fascial release, or is that more different with Chinese medicine?
So primarily, yes, for myofascial release, how other people do cupping.
Okay.
But there are other diagnostic features that you can use cupping for, like you can do it on the upper back for asthma and lung stuff, because it helps open up the lungs and the chest and release, the muscles of like the rhomboids and, the upper traps and stuff like that.
Okay.
So it can make breathing easier, but particularly on like kids, it's really good for childhood asthma and stuff like that to do it on the back.
Interesting. So I've had it, we have a massage therapist here that will do cupping. So I've had it here, but it was definitely just for like really bad, not in my lap.
Yeah.
So yeah.
Yeah, and that's primarily we're using it for that, but there are other reasons we would do cupping too. And a lot of people, if they have what we call like heat conditions, you can do cupping as well. It also can release heat in the body, so it brings, blood to the surface and everything like that to help release some heat. So we'll do it for that purpose too. But it's it's pretty cool. It's really, you can use it for a lot of different things, and I love doing cupping and gua sha too. Are you guys familiar with gua sha?
Mm-hmm.
So gua sha is, some people, chiropractors and stuff, will do a version of gua sha. They can call it Graston and stuff too. But these are some of the gua sha tools. Traditionally, we use a Chinese soup spoon. It's my favorite tool to use because it just fits really well in the hand. But there are these are some jade tools and stuff. But it's a similar effect to the cupping with the myofascial release, but cupping pulls the skin and the fascia up. Gua sha, you are going into the skin, so it's like a scraping technique, but it will leave similar marks. So you get like the round kind of bruise type marks. They're not actually bruises. All it does is break the surface capillaries, and I tell people what it's like is like a controlled injury. So if you have a tight knot or really tight muscles that have been that way for years, your body just assumes that's normal and regular, and it's not an injury anymore. When you do a controlled injury to it, like the cupping or the gua sha, and break those surface capillaries, now the body's like, oh, there is a bruise, there is an injury here, we need to send, blood and white blood cells and lymph and everything like that to the area to heal it. So in turn, your muscles and, everything in the area are going to heal a lot faster. So
when you do cupping,
will
one part of your body, like say like, I don't know, like a more inflamed part, or like the part that's actually like really bothering you, will that leave like deeper, darker bruises than opposed to,
Yeah, so it is really cool. Sometimes I will do like sliding cupping where we put oil on and slide, or gua sha, which I can do, a bigger area. Sometimes I'll do it and like one side, like I'll do people's neck, and like one side will turn bright red and the other side nothing, like just like a little red from like touching it, and I'm like, is the right side worse? And they're like, oh yeah, and I'm like, oh okay, that's what it's showing me. So it is really cool. And I can tell when someone might need cupping or gua sha, because when I'm palpating the area, the skin will oftentimes like blanch. So if you like press on it, like it will show that like it'll just like turn white and stay that way for a little bit, and that's a great indication that you might need to do cupping or gua sha or something like that, because the circulation is not flowing very freely through that area when that happens. So if we do that, then we usually get a really bright color, and then things start moving a little bit better.
So it's like, it's interesting. It's like you guys are following the story the body is telling you. Like, that's what I just got from that. Like, the body's going to tell you. I just got to find the right story.
Exactly, yeah. And we need to, and we'll do that with needles, too. So if I'm unsure of a point that I want to do or something, I'll push on it, and I'll say, okay, tell me which one hurts more. Is it this point, or this point? And they'll be like, oh, the second one. And I'm like, okay, great. That's where I need to put the needle in. And they're like, you want to put the needle where it hurts more? And I'm like, yeah, I do. So, yeah, we can do that and test points and stuff, too, and figure out exactly what the body needs. Right. And that's what we do. And what I love about it is it's not just we're giving you a medication, you know. And I always tell people, I think a lot of people, like, don't want to hurt my feelings and tell me that they didn't feel better after a treatment. But I have to explain to them, I'm like, when I put points in, it is me prescribing a point prescription to you. So it's like I'm giving you a medication.
Right.
You would tell your doctor if your medication was not working. Like, I'm not taking offense to it. Right. It just means I need to change the treatment. So if your last treatment didn't work, don't say, well, it kind of worked a little bit. You know, I felt better, I think. You know, say it didn't work. And I'll say, okay, I need to reevaluate and I need to change the points. There are over 400 points. I can choose more. Right. So I always tell them, I'm like, you're not going to hurt my feelings. Your doctor's feelings aren't hurt if you don't like the medication they gave you. So just tell me and I will change the point prescription and then we'll try again. Right. So, you know, there are rare instances that I'm like, okay, I wasn't expecting it to work. Yet, you know, someone who's had pain for 20 years, I don't expect treatment, you know, to work right away. So I'm like, let's stick with it for another treatment or two. Then if it doesn't work, we'll change things up. Yeah. But most of the time I'm like, let's add in a few more points. Let's change a location. Let's do this and see if anything changes.
Gotcha. So are your typical clients like return or is it like for a short period of time or?
Yeah, so it varies. At the first visit, we'll set you up with a treatment plan. Typically, we start people with chronic conditions coming about once a week for, you know, anywhere from 6 to 10 weeks, seeing how you do, kind of reevaluating. And then what our ideal, you know, course of treatment is that you do that initial one, you're feeling better, then we start spreading the treatments out. So if you're coming every week, we have you come every other week, and we see how well the treatments hold in between. If they hold great, then great. We stick to every other week for like a month or so. Then we go once a month and see how you're doing. And then some people just are better and off they go. Other people, I've been seeing some people for the past 6 years for every week, you know, just because they know that they need the maintenance. Their job, you know, inhibits what they can do, and they're like, well, I can't quit my job, so I'm gonna just come to acupuncture every week instead. So yeah, it all depends on what you can do lifestyle wise and stuff too. You know, if I tell people, all right, well, you can't be lifting, you have to, you know, go for walks every day, you have to do the stretching routine, if they can do that, they're gonna feel better a lot faster, and they're also going to maintain. If they can't, then, you know, if it's not feasible, if their job is lifting and they work long hours and they don't have time to, you know, go for a leisurely walk and do stretching or yoga or whatever, then they are not going to, you know, they're going to keep injuring themselves. So then they just have to kind of maintain until they're at a point in their life that they can make those lifestyle changes.
Awesome. So that's so cool.
Yeah.
What's like your primary demographic for patients?
It's so wide, you know. We treat kids. We treat kids. We have people in their 90s that come too. So I would say mostly like mid 20s to like mid 50s, 60 is like, you know, is the main range. But and where we treat women's health, we see a lot of like women between like 25 and 42, but really just a huge range. And we do treat kids under 7 we generally don't use needles on. We'll use you know, non-insertive techniques on them, and then even some older than 7 that, you know, or adults are a little, you know, apprehensive of the needles, and we have other, you know, magnet techniques, press balls, which are non-insertive needles that we can use, and most people after a treatment or two are like, maybe I can try a needle, and
it's comfort thing.
And then they try it and they're comfortable, and then they have full needle treatments and they're doing great.
Right. Yeah. Because I'm not scared of needles, but I think I would be anxious the first time regardless. And had blood taken many times. It's not a big deal, but okay.
Yeah, a lot of people are. Just a new thing too, and they don't know what to expect. So after the first visit, most people are like, all right, I get it, I understand it. It's actually relaxing. Like, I take a nap. We tell people you can bring, like, we have relaxing music playing, but people bring, like, their headphones, listen to podcasts, audiobooks, music, whatever they want.
Right.
And it's just, like, their time for the week, which is awesome.
Awesome. That's super cool.
Have you guys always done, like, specialization in women's health?
It kind of just evolved that way. Mm-hmm. I didn't go into practice with any sort of specialty. It kind of just finds you. You just notice a huge influx of patients for these things, and then patients get good results, and then they send more patients like that to you, and you're like, okay, now I have, 15 patients all going through IVF this month, and then I have 15 pregnant patients and stuff like that. So it just, like, very quickly kind of evolves, and it's funny working with fertility though too, because you have such a close relationship with a patient while they're, I'm seeing them every single week while they're going through fertility treatments, through their pregnancies and everything like that. And then they, like, have their baby, and obviously they're not, they have a newborn, so they're not coming in, like, postpartum, and then I, like, just don't see them for a while until they're ready to have another one, and then they come back, and then I see them for 10 months or so, and then they're gone again. So it's kind of like an ebb and flow of patient relationships, which is nice.
But, like, awesome that you get to help them on, like, that journey.
It's really rewarding, and it's so fun to see patients, coming back when they, showing pictures of their babies or bring their babies in and stuff like that. And it's really cool. And the IVF process for women is incredibly overwhelming. They just throw so much information at you, and the fertility clinics are so busy they don't have the time to, like, explain it all. So luckily, me and my other acupuncturists have seen enough patients and are familiar with all the different fertility clinics and their kind of, way of doing things, that we can kind of prep people and just be like, okay, like, this is how it's gonna go. You're gonna do this, and then we're gonna be here with you, and it's gonna be very touch and go for a while because they have to do blood work and ultrasounds and all this, and just, like, warning them what is normal as they go through the process, because a lot of people are so discouraged once they, like, they're like, what, I got 20 eggs at my egg retrieval, how do I only have 4 embryos? And I'm like, that's completely normal, but the fertility clinic doesn't sit down and tell you that. So a lot of people have been appreciative that, like, we kind of know some of the behind the scenes stuff and fill them in, because they're like, oh, I would have been really concerned about that if you didn't warn me that this could happen. So
well, obviously, if you're at that point, you've been trying
for
a while.
And a lot of people, the mental emotional aspect of it too, and with all chronic pain and stuff as well, it takes a huge toll on you. Whether it's fertility, chronic pain, or just some other mental emotional aspect, it's gonna affect you. You're gonna be anxious, frustrated, depressed, stuff like that. It just comes with the territory. So it's nice that we can treat the physical and the emotional at the same time.
Well, and it's so funny. I think, like, every practitioner, you almost have to have, like, a little bit of a therapist mentality.
Oh, for sure.
Like, we should run it as personal
I was
trainers.
literally just talking about this with my client before. I'm like, I am part therapist.
Yes. Oh, yeah, I'm sure.
So, like, you have to, because if you were just cold, like, that bedside manner is not just Western, like, it has to be everything. We do a wellness group where the first thing we do is a blood prick and then talk about their body composition.
That's
it's
really
uncomfortable.
Cool.
So, like, we have to be there to, like, talk them through and stuff, and it's just what you're doing. You're doing physically helping them, but emotionally helping them, which is kind of cool.
For sure. Yeah.
Awesome. So your business, you own a wellness center as well. So you partner with different practitioners within there.
Yeah. So we have right now we have a massage therapist group. They have, I think, 6 or 7 massage therapists now, and they do like energy work, Reiki, and stuff like that as well. And then we have a woman who does not necessarily counseling, but she does like liaison work with like kids and schools and families and stuff like that. So a lot of kind of like family support and help and stuff, which is awesome.
Yeah.
And then my assistant that works with me does private cupping, gua sha, moxa, LED light therapy appointments and stuff too. So it's a really nice cohesive group that we have. We'll do a lot of kind of referrals back and forth to people, and it's nice if I think someone like needs massage, I'm like, all right, just go next door and, you know, go book an appointment with them, and, you know, vice versa. They'll send people over to us too, which is nice.
And so if it's just 3 women in your part of it.
Yeah, in my office it's me, Allison, our other acupuncturist, and then Michelle, who is our assistant. And if anyone's watching and you are a licensed acupuncturist and you would like a job, please reach out. There is a short supply of acupuncturists here.
Yeah.
And, you know, we have a several month waiting list to get in for new patients, and we are...
That's awesome.
Actively, it is awesome, but I feel terrible because I am like instant gratification. I want to get people in, and people call and they're like, "I'm in so much pain." And I was like, if I could squeeze you into the schedule, I would love to squeeze you into the schedule, but like I can't.
Right.
So, so we are actively looking for another acupuncturist. If anyone would like to join the team, please reach out. But yeah, it's an awesome group, and it's great having another acupuncturist there, because sometimes we do get stuck, and I'm sure you guys as trainers and stuff, it's awesome to bounce things off of someone else and be like, you know, we're kind of stuck here in this treatment plan. What do you suggest? And then sometimes she'll say something, and I'm like, that didn't even cross my mind. I'm like, great, we're going to give that a go. So it's like 2 minds are better than one.
Right.
For sure.
Well, that's funny. So I've been wanting to have this conversation for a while because, like I told you on the phone and today, know zero about this. So I'm like fascinated right now.
Yeah.
But it was hard to find somebody. I'm glad I randomly wrote on Facebook and she responded. It worked out really well.
Hey, it works out.
Facebook, it's a great thing.
It is. It is a very good. It's got its good and bad, but for networking and meeting other, you know, practitioners and wellness professionals and stuff like that, it's been awesome.
Right. So do you get many like referrals for acupuncture from practitioners?
Yeah, so we're actually getting quite a few from more and more doctors now and stuff are being like, it used to be someone would say, oh, do you think I should try acupuncture? And it would be go ahead if you want, you know, maybe. Now it's much more like, have you tried acupuncture? And we're in network work with several insurances, so we get a lot of people, you know, through their insurance and stuff. And we are partnered with the VA, and they must have done some sort of in-service with their practitioners on acupuncture or something, because we have gotten a huge influx of VA patients. The VA is really pushing acupuncture and, you know, non-pain medication ways of pain relief, which is awesome. So we're getting tons of veterans, and they're seeing awesome results, which is really cool. So it's nice when people get results and then go back to their doctors and tell them that they're feeling better, so then their doctors know, oh, I can like confidently refer another patient with a similar condition to acupuncture or, you know, whatever kind of treatment it is, and they'll know that there's a good chance that it's going to help. So. Oh,
I love the veteran thing, because they already have so much trauma.
Yeah.
They do.
And a lot of them are men too, and you don't see men do like self-care, like acupuncture
especially
or
the
cupping.
50, 60 age group.
Yeah, it's like weird to them.
Buttercup.
Yeah.
Well, that's how I figured out that it was that the doctors were sending them to us, because we used to get, you know, here and there a veteran, but it would be like a young woman or like someone, you know, or like an older woman that like had been getting acupuncture before. And I was like, awesome. They're like, yeah, I asked my doctor to write a referral for me to come here. And I was like, awesome. But now I'm getting these like men that like are like, I don't know anything about this stuff. And I'm like, did your doctor? They were like, yeah, I don't know anything about this. They told me to come try it. And I was like, okay, well, welcome. So, it used to all just be people that were like, oh, I've gotten acupuncture a ton of times, and I just told my doctor I needed to do it again, and they wrote me the referral. Now it's people that are like, who knows what this is. Right. So, but it's fun when it's skeptics like that, because I had one guy, and he was like, I don't know. He came for his second visit, and he was like, I don't want to offend you, but when I came last time, I was like, I don't know what this kind of quackery is, but I'll just give it a try. I got to check all the boxes, say I tried everything. And he goes, I feel so much better this week, and I had almost no pain for several days after my last treatment, and I was like, awesome. He's like, I don't know what you do, but just do it again. And I was like, okay, sounds good. Witchcraft you're doing is working. Yeah, so it is kind of cool when you get people that know nothing about it and it works, and I'm like, oh, okay, it's totally not just placebo, like as if I need to convince myself of it, but it's really cool when it's like a skeptic of it that's like, I don't think this is going to work, and then it does, and they're like, wow.
Right. Well, the body is so fascinating. Like, how do we, there's got to be all certain things. It's a puzzle, and you have to figure out what works.
Yeah, like, for sure.
Oh, that is so cool.
That's awesome.
So if you wanted somebody to know, like, one thing you want them to know about your business or about acupuncture, like, what would be, like, your message, your tip, whatever?
Yeah, I would just say the main thing is, like, you don't need to wait for something to be so serious that it is impacting your daily life to, have it addressed. Like, nothing is too small. Like, I have people sometimes just come in and they're like, I just kind of want to keep, everything. They're like, I have family history of high blood pressure and stuff like that, but I would just like, I don't have it yet, but I would just like to keep it that way. Right. So it's not necessary that you need something terribly wrong with you that, like, you can't walk from back pain or something like that to do this type of stuff. And it's not that you have to come, every week. You can come here and there, just kind of maintain, make sure you're feeling good, and, take care of yourself. Yeah. Take care of yourself in all manners before you get sick. So many people wait until they're sick or injured to start taking care of themselves, and then it's a lot harder. I tell people, I'm like, if you had come before, you had this crazy high blood pressure and were on 3 medications and stuff like that, it would have been a lot easier to address this. Now, we have medications that are playing a part of the body. We have, your high blood pressure. We have your anxiety around it now, and we have physical symptoms and stuff. So now we have a lot more to work with. So starting early is number one. Yeah. And, I'd say that's it. Just take care of yourself before it gets too late, and don't. And a lot of people too think, oh, I'm getting this treated by my doctor. I'm taking a medication. That doesn't mean that you can't also do other things, because you can get off medications and stuff. Of course, like with the guidance of your doctor, like absolutely, you're not, taking yourself off any medications. I'm not taking you off medications, but like I've seen a lot of patients that have started coming for treatments and then go to their doctor and they're like, oh, I went to my doctor and they said my blood pressure was so good, they lowered my medication. Awesome. Or like, I'm not taking ibuprofen as much anymore. And you'll see those subtle changes, and we can work really well with Western medicine or other, practitioners and stuff like that too. So I'm not a practitioner that is like, I am better, I know better than everyone. If you come to me and said, oh, my trainer says my quad is really locked up and stuff like that, I'll say, okay, great, let's take a look at it. Like, and then I might send follow-up questions. I'll say, ask them next time, like, what exercises should you be doing, or is there anything that I can do to help make your training sessions better or something like that, So I always, will like work with whoever's on your team to make the most effective kind of treatment plan that we can.
Yeah. I think you hit 2 awesome points. Self-care is not selfish.
Yeah, you got it. You got to do it for you and like your family and your friends and stuff like that too, you know?
Yeah, and then having a tribe like behind you to help you is so important.
Yeah.
We've talked to a good amount of practitioners, and I love that they're always like, so we had a chiropractor who's like, of course I want you to talk to a massage therapist and all of this. Like, you should have a group behind you because all those minds think differently. That's going to be your best course.
Help you.
Yeah, for sure.
Awesome.
And it's nice to not be the only one on a team, you know, that you can you can bounce things back and say, you know, what are you thinking about this and stuff like that. So it's awesome.
So where can people find you?
So we are everywhere. Our website is essenceacuherbs.com. We're on Facebook, Essence Community Acupuncture, Instagram, Essence Acuherbs, or you can come see us at 2 Rocky Gutter Street in Middleborough.
Awesome. All right. Well, thank you so much for coming in today. This is awesome.
Thank you guys so much for having me.
I learned a lot.
So good.
Guys, thank you so much for watching or listening today. Really appreciate it. Danielle's awesome.
Yeah, I hope you guys learned as much as we did, because
you can see my face if you're watching video. I'm like fascinated, like playing with the needle, because it was.
I think my mouth was like at one point.
But she was awesome. Clearly, just passionate again about what she does. I'm a very big anti-medication if I can avoid it person, so I love hearing about practitioners giving those options.
And actually giving referrals and not being like, here's this crazy stuff that may work or may not.
And I was super excited to hear it was insurance covered.
I
did not know that.
That must be new.
Which is great. So we're recognizing more of these other treatment plans, which is fantastic. But I really love talking to these health professionals.
It's cool. You're learning.
So cool. There's
a lot you can do for your body other than
actually for us to learn. And how informative your body is. So
our
cool.
bodies are capable of so much, and our body will tell us when something's not going the way it should be.
And it's so funny. She's talking, and I'm thinking about like Beth and the pelvic floor stuff, and then I thought about the chiropractors. I thought about Christina and the massage. It's just so interesting.
All related.
All right. Well, thank you guys so much. Make sure you're following us on social media at The Bolder Side of Wellness, and you can follow me at Honestly Lisa B.
And me at Ashley Palmer Fit.
Check out our website, www.bouldersideofwellness.com. And if you want to be on the show, absolutely reach out. You can DM us on Instagram. You can email us at thebouldersideofwellness@gmail.com. Or if you are in the club, please come up, talk to us about it. We have anybody from members to local professionals too. If you have an interesting health professional
job.
I found Danielle on Facebook, and it was a phenomenal conversation. So awesome. Thank you guys so much, and we'll talk soon.